After a patient at Eastern State Hospital escaped Saturday morning and police found him a day later, Richmond is promising changes. It is the second time Glenn Large Jr. got out of Eastern State this year. Investigative reporter Chris Horn has more from a former security guard there and is looking into the state of security at Virginia's mental hospitals.
Yeah, it was just a few years ago, Regina, that the General Assembly approved more than $8 million to beef up security at state mental hospitals across the Commonwealth. So far this year, convicted murderer Glenn Large has been able to overstay a community pass. That was one case, and jump the fence at Eastern State. That was the other. Glenn Jefferson Large Jr. was convicted for a 1988 Virginia Beach murder, but he's a patient here at Eastern State Hospital for other crimes. In a case from 4 years ago, he pleaded not guilty by reason of insanity for attempted malicious wounding and indecent exposure. A former guard at Eastern State spoke with Wavy in March when Large was unaccounted for after getting a weekend community pass.
They usually, if they go out on the weekend, they'll go visit their family or something like that. That's usually how they get passes if they're on good behavior.
But Large was at large for nearly 3 weeks in March when he was returned to the mental hospital. It's near the campus of William and Mary.
These patients can be like ticking time bombs sometimes.
Fast forward to this past weekend when state police say Large was able to jump a fence.
You would think that there'd be more stringent rules on tracking these individuals when they got in the community.
And Large was out in the community for about a day this time. James City County Police arrested him without incident and took him to jail. But 3 years ago, the state budget dedicated $8 million to beef up security at Virginia's mental hospitals, as reported by the Virginia Mercury. The money would go for additional officers. Instead, Large was able to thwart security twice within a few months. And the Department of Behavioral Health and Developmental Services responded late this afternoon. A spokeswoman emailed me that Eastern State will conduct an internal investigation, adding that the safety of patients and those in the surrounding community is critically important. She also wrote that Eastern State will update staffing and protocols to prevent these escapes from recurring. Chris Horn, 10 on your side.